Our White House correspondent, Jake Tapper, sat down today for an exclusive interview with the president and asked him about Brian's information that the U.S. knew Major Hassan was reaching out to al-Qaeda.
Without getting into specifics, are you concerned, based on what you know about the case at Fort Hood, that the government was not talking to itself the way that after 9/11 we tried to ensure it would?
Here are the two things I can say right now. Number one, we are all heartbroken by what happened at Fort Hood. And I'll be heading out there tomorrow so that I can personally express the incredible heartbreak that we all feel for the loss of these young men and women. The second thing I can absolutely commit to is that we are going to complete this investigation and we are going to take whatever steps are necessary to make sure that something like this doesn't happen again.
President Obama also talked today with Jake Tapper about health care reform and Afghanistan. Over the weekend, the House passed its version of a bill which calls for cuts in Medicare to pay for health care reform. So Jake asked the president how firmly he stands behind those Medicare cuts.
One of the concerns about health care and how you pay for it, 1/3 of the funding comes from cuts to Medicare.
Right.
Are you willing to pledge that whatever cuts in Medicare are being made to fund health insurance, 1/3 of it, that you will veto anything that tries to undo that?
Yes, I actually have said that it is important for us to make sure this thing is deficit neutral, without tricks. I said I wouldn't sign a bill that didn't meet that criteria.
So Congress needs to know that you'll veto any attempt to walk back what they pass.
Congress needs to know that when I say this has to be deficit neutral, I mean it.
You're about to make a final decision about the new strategy in Afghanistan and Pakistan. What variables play into your decision making that would cause you to not just take General McChrystal's recommendation and implement it?
Well, keep in mind that I've been asking not only General McChrystal, but all of our commanders who are familiar with the situation, as well as our civilian folks on the ground. A lot of questions that, until they're answered, may create a situation in which we resource something based on faulty premises. And I want to make sure that we have tested all the assumptions that we're making before we send young men and women into harm's way.
You, in the last week, have gone to Dover.
Yeah.
You have gone to Walter Reed. Some people might say these experiences would cause you to be more reluctant to send troops into harm's way. Some might say that we know some of the families have said, don't give up.
Yeah.
So that these people didn't die, our sons and daughters didn't die for nothing.
Right.
Other than underlining the gravity of the decision, does it have an impact on you?
It absolutely has an impact because it reminds me of the costs involved, and it reminds me that these aren't abstractions. The decisions that we make in this White House have consequences for our long-term security. They also have consequences for the individuals who are being deployed. Now, as Commander-in-Chief, my job is not to just think in terms of one individual or short-term costs, but also what's required to prevent another 9/11, what's required to make sure that we're not seeing another U.S. Cole, and ultimately when I make a decision, it's going to be based on the overarching view of U.S. national security. But I think I would be making poor decisions if I didn't have to look into the eyes of a family member who had lost a loved one and tell them how grateful we are as a nation. That moment, I think, ensures that I am making the best possible decisions going forward.